Hello, everyone. Good morning, afternoon, evening, wherever you are in the world today. We're so glad that you've joined us. Today, we are going to be talking about SEI ethics, scope of practice issues with Bhanu Joy Harrison. We have created time for Q&A during the presentation today. If you have a question, feel free to drop it in the chat. You can chat directly with Bhanu, or if it's another question, you're welcome to ask me or Abby. And you can also raise your virtual hand if you would like to come on screen and ask your question. That would also be lovely. Just a reminder, we do have closed caption turned on. That's available for you. This is being recorded and it will be available shortly on our website for free. Abby's going to drop that into the chat so you can see where that will live. And with that, I'm going to hand it over to Bhanu. Thank you for joining us today.
Great, thank you so much, and welcome everyone. It's good to see some of your faces, and I am excited about this topic. So just a little bio about me. I have been an SEP. I've started the training in 2002, and I'm a clinical social worker and have used SE in my practice ever since then. And prior to that, I was a massage therapist. So I've had multiple licenses and overlapping licenses. In addition, I teach continuing education ethics to body workers and to counselors, social workers, etc. in the state of New Mexico. I'm in Albuquerque. And scope of practice issues, just to kind of give you a frame for this workshop, I don't have all the answers. I am not a lawyer. You're all in different states. You all have different professions. And in fact, I would love for each of you to drop in the chat where you're from and what licensure you hold, if any, or what your field is. Are you a yoga teacher or a coach or a psychologist, etc.? And that would help me know who is here present, and your profession would be great. And I think that just came to me as a direct, Susanna, so you can hit to everyone. So scope of practice is challenging because there's such diversity, such in different states, different, all of that. So right now we just have everyone sending me direct messages, so we've got a somatic leadership coach, there's RN, LPC, LMFT, yoga teacher. Oh, everyone's not an option. Oh, that's interesting. Yoga teacher, okay, yoga and mindfulness, psychotherapy, LMSW, LCSW, PT, good, okay. I'm also a certified mindfulness educator from UCLA. So we have quite a few. I don't know if there's any body workers here today. So equine facilitated learning instructor. Okay, that's a different one. A healing touch practitioner, end-of-life doula for humans and animals. Yeah. So dance movement therapist. So this is the beautiful diversity of the SE trainings. So how I like to do webinars and trainings is I have a PowerPoint with some slides. I will be coming on and off the PowerPoint. I'll go through some material and then come back onto our gallery view here so that we can have a section for questions, so you don't have to hold them all to the end. And then we can have some conversation. So you are welcome to be off camera during the PowerPoint, but then I love to see faces. I feel like my ventral vagal system is definitely much more engaged when I see a few faces, especially if you have some questions. So anything that you need to make yourself comfortable in this practice at all, or in this webinar rather, practice, we're having a mindful scope of practice webinar. All right, I'm going to jump on my share screen and we will begin here. Okay. So this is the third out of 4 ethics webinars that I've been doing with SEI. The last one will be on creating an ethical practice, and it will probably be January, I think, when we have this 4th one. All of them will be posted on the ethics page of the SEI website. And this is offered so that we can move the whole institute towards a greater ethical posture and stance. The first one was on the SEI Code of Ethics and the Code of Conduct. So this is all to enhance our practices. So what is happening today for this topic is I'm going to define scope of practice and how the SEI Code of Ethics interacts with scope of practice, why scope is an ethical issue. And then I want to highlight some different scopes for different professions, just so we can begin to see what is all out there. And then we'll be covering some challenges in scope of practice, and then some guidelines of how to practice within your scope so that you keep your clients safe, that you keep your own self and your own practice safe as you do your beautiful work. So what is scope of practice? So this is lingo that appears in state licensing definitions for licensed practitioners. So in every, if you hold a license through a state board, and we're talking just about the US, I don't have any clue how it goes in international. But if you hold a license, your board of licensing and regulation will have a definition within their licensing statutes about what your scope of practice is. So it basically is what you can and cannot do with that particular license. If you are unlicensed, if you have a professional organization, for example, coaching, there's the International Coaching Federation. If you are a yoga teacher, there's the Yoga Teachers Alliance. Professional organizations will often have scope of practice parameters and a code of ethics that can help you delineate what your scope is. If you hold a license and you go out of your scope and there is a problem with a client and they make a report, you then can be subject to disciplinary action, legal action, or potentially having the loss of your license. And so kind of the bottom line thing is if the skill requires licensing, then you must have a license in order to practice that particular modality or that particular area of healing. And we'll be taking this apart in much more granular detail in a few moments. And scope of practice is an ethical issue because when you practice within your own scope, then you increase safety for both your clients and yourself. And it can mitigate effects of re-traumatization. And that is a good thing for everyone, right? And it's an issue in all professions in terms of scope. So state boards, if you're licensed, the existence of state boards is not to protect the license holders, the practitioners, but to protect the public from unethical or unscrupulous practitioners. So this is from medical boards to, architect boards to whatever license somebody has to hold. And so licensing boards exist to protect the consumer. So that kind of gives the overview and definition. And so how does this fold into our SE scope of practice and code of conduct that SEI has put out now? And so in standard 3, there is professional and ethical behavior. And basically this is the piece under number 2 of standard 3. It says that SE professionals shall not represent themselves as competent to perform professional services beyond the level of training, experience, or competence. So with this, you probably get a sense that, well, that's rather vague, right? And most ethics descriptions are very kind of broad and big umbrellas, and are not really kind of specific, kind of rubber to the road. Certainly, we don't want to practice beyond our level of training, experience, or competence. And, that is, there's so much more than that. So just a reminder that the SEI Code of Ethics and Conduct is basically established for SE trainings. At this point, because we don't have a professional organization, some SEI does not regulate or kind of have jurisdiction over your private practices. And so, one very common issue that arises when a client has a complaint that they submit to the ethics committee that is about a private practice issue, that is not something that SEI can address. So we're kind of straddling here, right? So SEI doesn't, kind of have oversight over our private practices, and SEI wants to give information through these ethics webinars of what is good practice for your own individual practices. So it is a bit of a straddle between two things, because it's just the way it is. But scope of practice issues come up frequently in trainings and in questions with practitioners. And so that's why we thought it would be really important to put this particular topic out as one that we want to give information about. All right, so let me just check the chat and see if, so within the context of SE graduates, we represent a tremendous diversity of fields. So there's a lot from mental health practitioners to coaches, nurses, doctors, clergy, all different kinds of body work. People that hold master's degrees in public health and PhDs, first responders, meditation teachers, yoga teachers, dance and movement practitioners. It's very, very diverse. And there's no way that I could know the scope of practice of all of those particular professions. And so I've kind of set this webinar up to have a dialogue and offer you a thinking process, like a inquiry process of what questions do you need to ask yourself to determine if you are practicing within your scope, right? And where do you look and where do you find your scope of practice, depending on your professional, field. So at this point, I'm gonna just kind of highlight some of the main professions that show up in SE practitioners, just to give you a flavor of what the scope of practices are, the differences within different professions. And so this particular slide is more the mental health scope of practice. And I've included like New Mexico counselors, New Mexico psychologists, social workers, and they all have a very similar scope of practice. Psychiatrists are the only ones, except if you're a medical psychologist, that can prescribe medications. But in terms of psychotherapy or counseling, they're very similar. So mental health practitioners diagnose, evaluate, hopefully prevent, and also treat mental, emotional, or behavioral disorders. And we, establish treatment goals, objectives, plan, implement, and have many different modalities available to us to get specific training in to work with our clients. And so, I have training in EMDR, I have my SEP. Those are the two main kind of certifications that I hold, in addition to my mindfulness facilitation. And so here's a scope of practice thing for, mental health. As a social worker, I can work with individuals, families, groups. I can work within schools. I can work within the medical, be an interface in the medical professions. I can work with, community groups. So my particular target audience, so to speak, is very broad, right? Counselors, psychologists, and psychiatrists tend to work more one-on-one. So for me, I could work with teenagers, right? I could work with children. That is totally within my scope of practice, but I don't have specific training in working with adolescent behavior. I don't have training in addictions. I don't hold a substance abuse certification. So even though it's within my legislative scope of practice that I could work with addictions, I could work with marriage and family counseling, I have not received specific training in those particular fields. So I do not feel competent to work with clients in those particular domains, right? If someone comes to me for substance abuse or asks to get scheduled, I will refer them, because that is not my expertise. And it gets tricky because we all know that oftentimes the substrate and the underlying piece of addiction issues is trauma, right? So I would be competent to address trauma issues, but I'm not competent to see the signs and symptoms of addiction. And it would not be in the best benefit of my client if I were to work with them with trauma work, SE work, somatic work, and not have good information and diagnostic and assessment skills for, are their addictions getting worse? Are they getting more activated? Are they using more? Are they, in the context of my trauma treatment? So I could do a disservice to my client because I don't have that additional expertise. So in New Mexico, part of the scope of practice is that psychologists cannot do touch work with clients. That may or may not be pervasive throughout the profession in other states, but they're not supposed to touch. So I had a very good friend who was an acupuncturist, a body worker, and a psychologist. And he chose not to be licensed as a psychologist because then he would be restricted on touching people. And he liked doing body work and acupuncture. So you can see that it gets complicated, right? So he didn't want to violate the psychologist licensure by touching, but did he have skills to work with emotional issues? Absolutely, right? But working with emotional skills, is that within the scope of practice of body work and acupuncture? Not really. So herein lies a bit of a dilemma, right? So this is what we're going to try and parse out and thread. So this is the counselor, psychologist, social worker piece. And let me just check in to see. I'm going to just stop my share for a minute and see if there's any questions. None have come through. So this is a great question, Jessica. It just typed in, why couldn't my friend work both as an acupuncturist and a psychologist as clearly separate offerings? So that is a great question. What I have found is that you can try to do that, and it's hard to parse those out, right? Because we all know that how do you separate out the mind from the body stuff, right? The mind and thinking has an impact on our body function, right? And our emotions have impact on body and our thought. And yeah, so it is hard to switch hats between that. Now, there could be some clients that could be very specifically, I'm doing acupuncture and I'm doing psychotherapy as a psychologist, and that's perhaps a little more delineated. So some people might be able to pull that off. And that certainly is an option. And you would just have to be very clear with your clients, because they're maybe coming to the same office, right? That today we're doing acupuncture, right? It's hard to have one client kind of go back and forth between the two different things, but you could have separate clients that are psychotherapy, separate that are acupuncture. Yes, so I'm going to be talking about some nurses stuff too. So I'm going to try and touch on as many different professions as possible with this. So any other questions kind of concerning the psychotherapy realm? I mean, this is probably the broadest piece. I'll come back to the touch piece with psychotherapy because it can get a little wonky. I have some personal experience with that because I held 2 licenses for a very long time. I held massage therapy as well as clinical social work. So, but I want to kind of get through some of the descriptions, and then I'm hoping that we can really chew on this and really kind of get some, at least what kind of questions do I need to ask myself to see if I'm in scope. So I'm going to go back on my screen here and we'll move along to the next profession. So there are quite a number of body workers that are SE trained. I went to an SE body worker that was in my cohort after my car accident in 2004, and it was profound work. So in New Mexico, I highlighted a New Mexico scope and also a New York scope of practice for a licensed massage therapist. And basically, they both kind of address it as working with soft tissue of the body for the treatment and prevention of dysfunction, for the reduction of pain, to maintain rehab or augment function and all of that. And how we do that as body workers, stroking, kneading, tapping, using hands or vibrators for the purpose of increasing muscle tone and circulation. There's nothing in that scope of practice that talks about emotions. There's nothing that talks about trauma because PTSD is a mental health diagnosis. We all know that body workers address trauma very directly through their hands, right? And through their skills of reading the body. And we all know trauma is held in the body through a variety of, whether it's injuries, whether it is fight, flight, and freeze responses, fawn responses that are held in the body in terms of certain structure. And so it's often inevitable that body workers, as they begin to shift structure, that emotions arise and that perhaps memories arise of past traumas, and how to be with that and stay in scope of practice, right? So I have a whole slide on that later in the presentation. There are, I think, currently 4 states in the US that do not have any licensing for body workers: Vermont, Wyoming, Minnesota, and Kansas. And what that means is, if I were living in one of those states, I could go to a 150-hour weekend or, month-long training, or maybe a 50-hour training, and put out my shingle as a body worker. This is one of the reasons why states have adopted licensing, because in New Mexico, there's a 650-hour requirement. There's an ethics requirement, there's testing that's required to ensure that body workers have some level of competence and knowledge and understanding, physiology, anatomy, techniques, ethics, when to refer, all those kinds of things. In places where there's no licensure, or in professions where there's no licensure, you have to hope and trust that the person is adequately trained. Okay. So just to give you an idea of, I think I'm going to share this later, my own experience. So that is body workers. And kind of folded into this, movement, yoga teachers, dance practitioners, Feldenkrais people, Rolfing, Hakomi. There's like this whole grouping of kind of somatic movement body professions. And the Yoga Alliance, in terms of their scope of practice for yoga teachers, is again sort of this generic statement of members must not provide advice or services for which they are not properly and currently licensed. Yoga teachers may provide referral lists of resources for students, medical, mental health people, law enforcement, crisis lines, etc. So that is the professional organization giving, because yoga teachers are not licensed in any state. There are certifications, right? You can be a registered yoga therapy teacher, you can be a registered yoga therapy instructor, you can be, there's, certifications for trauma yoga therapists, and there's, a whole palette of certifications, but that is different than a license. A license is from state government, and that is different than a certification process. Let's see here. Okay, this is a great question, Claire. I'm going to address that in a minute here. So thank you for putting that out. It was about nature therapy, a nature therapist, right? So, so the scope of practice gets less clear when there's no licensing, because there's no way to regulate. And so there is now, I know there's training for yoga teachers and mindfulness teachers in trauma-sensitive practice, trauma-informed practice. For example, this particular picture of a yoga teacher doing a hands-on assist in a posture, for some students that have a trauma history, that particular hands-on could be triggering to the student. And so there are some strategies coming out for yoga and movement teachers, that there's a little token that the student can put on their yoga mat. That's yes, you can touch me, and no, don't touch me, right? They turn the little wooden token in a particular direction, and it gives the teacher a notice right there on the mat that I can touch this student, or I should only use verbal correction, which I think is a beautiful trauma-informed skill to keep your students safe, right? So I think those are wonderful, and that's being folded more into these, other professions that don't have licensure. Coaching is as a field has really grown dramatically. And I don't expect you to read all of this, it's here, but basically health and wellness coaches, professional coaches, basically work to help their clients empower themselves and to move forward in time with achieving goals, and mobilizing resources, and getting practices and habits going for a more productive lifestyle, etc. And coaches tend not to go back into the past. And it says specifically, the International Coaching Federation has great resources. I have 2 links here for articles on scope of practice for coaches about when to refer. Basically, coaches are not trained to handle major mental health issues or behavioral problems, or you can't treat or diagnose a mental health disorder. They are very clear about that fact, that coaching is not psychotherapy. And so, where does SE fall into this, right? I mean, if you're a coach and you have a coaching client that says, I was bullied and put down frequently, and so here I am now in this corporation, and I want to have a stronger voice, but I have a big history of fear and freeze response, around speaking up. Okay, so you're not going to, as a coach, you're not going to address the bullying incidents, right? Because that would be going back in past, that would be more psychotherapeutic. But can you move forward and practice skills and get resources for noticing when your body might be dipping into a freeze response? That could be really helpful, right? That would be where you could access your somatic experiencing training, and working with, what arises for this client in a meeting. What happened to them? What was their response? Again, it is tricky, right? Because it's not therapy, but it's about moving forward in their life. And it's a little bit of a gray zone. Okay, so that's the coaching. So in the medical field, so nursing and physical therapists and occupational therapists, respiratory therapists. Let's say you're a respiratory therapist and you're working with COVID clients. There's going to be some trauma there, right? If you're working on rehabilitation of the lungs and that kind of thing. And so in scope of practice for nurses, and this is New Mexico, a licensed professional nurse, which is a lower level nursing licensure, they can't diagnose or prescribe any medication. So they often handle kind of more routine clinic or hospital functions, dispensing medications, caring for the patient, changing bandages, that kind of thing. I didn't look to see about doing some massage therapy, because there is some overlap with massage, nursing, and physical therapy of an occupational therapy with touch, right? PTs can massage an area. Massage therapists certainly can massage. Nurses can do a back rub on a client, on a patient, right? So there is some overlap in terms of scope of practice. A massage therapist can't change a bandage or know if a bandage needs to be changed. A massage therapist can't assess for, exercises or do range of motion tests, which would be in the purview of physical therapy, right? So there's sort of some overlap, it's kind of like it's like a lotus Venn diagram, right? Where there's some overlap and all of that. So a registered nurse in most states can certainly administer and monitor medications. Sometimes they can diagnose, take vital signs, care for wounds, provide basic life support. EMTs obviously can perform basic life support in the context of emergency treatment. They probably will do more trauma first aid types of skills as opposed to SE sessions. PTs, I mean, you're gonna be dealing with trauma, right? You have an injury, there's pain, there may have been a fall, there may have been a car accident, there may have been surgeries, medical traumas that arise within the course of physical therapy sessions. Now, physical therapists, there's nothing, I mean, this was from the PT scope of practice was from the American Physical Therapy Association. So here's where it gets very broad and kind of gray, is PTs can optimize physical function, movement, performance, health, quality of life, and well-being. So, well, working with trauma patterns in the body, that certainly will contribute to health and quality of life and well-being. But if you talk about emotions as a PT, is that in your scope of practice or not? It doesn't say anything about emotions, right? It's pretty gray what the scope is. And yeah, so this is a challenge. So let's see if there may be okay, so I'm going to take a break here, come off of my screen, because these are the main professions that I have highlighted in terms of scope of practice. There was a question from Claire. I've been an arts for health practitioner and community worker for 10 years. I use nature a lot in my work and want to use more towards ecotherapy, using SE principles. As far as I'm aware, in the UK, there isn't a body for this. So I'm a member of a complementary therapies regulating body. That's great. Yeah, so as a student in SE training, she's saying she has a big question until she's a certified somatic experiencing practitioner, how to move forward with using SE in scope of practice. So I would say, if you're in beginning year of SE training, you can practice and utilize the skills that are taught in SE1, training beginning 1 or beginning 2, right? And begin to fold in, how can you resource someone? I mean, what a beautiful thing to lie on your back under a tree in an eco nature session and begin to incorporate somatic resourcing in the experience of this eco session. I think that would very much be within your scope of practice. Okay, so as a body work, I'm going to go more into massage therapy, Jessica, because she said she has similar questions as a massage therapist. What lands in my scope? So I will go specifically into the whole body work piece, because I think that will relate a lot to movement and dance people as well. So in terms of like nursing, I think there's a lot of trauma-informed pieces that you can bring into your practice of nursing. For example, Deb Dana has a great, the 3 C's of what nervous systems need for safety, right? We need choice, we need context, and we need connection. So if you're, let's say, having to, do an IV as a nurse, okay, giving them choice, which arm would you like it? Have you had experience? Would you like an IV in your hand? Would you like it more on the arm? What has been, just giving the patient some choice over maybe where the IV goes in, the context, why is this important that we do an IV, and then connection. I know this might hurt a little bit. I'm right here with you. You can ask me any questions. So this would be using kind of SE principles in a medical intervention of placing an IV that brings in choice, context, and connection to enhance safety for the client's nervous system, for the patient's nervous system, right? So, I think people, students, clients, patients do better when you don't segue like, I am going to do some trauma work with you now, so I'm giving you choice, right? That may not be the most effective way to say, hey, I'm going to bring in some trauma-informed principles here that hopefully will make your stay in our hospital less traumatizing, right? Oh, and Priscilla, this is a whole area I forgot about. Teachers. Yes. Teachers in the classroom. It's huge, and especially with children, right? Bringing it in. So Claire is saying she's using resourcing and SciBAM at the moment with the eco nature thing, and that's helpful to know she's on the right track with it. So yes, teachers. So trauma shows up in classrooms, whether it's from preschool all the way through doctoral programs. And, I think psychoeducation is huge in terms of helping students understand their nervous system. And I think that you can adapt that for the age group that you happen to be in. And you can bring principles of individual and group regulation to children. The whole field of social and emotional learning curriculums that are in especially elementary and high schools are very well adapted to bring in SE principles, right? Also, as a teacher, you may be dealing with a fall in the playground and trauma from, bullying or that kind of thing. And so addressing, there's a great book that Maggie Klein wrote along with Peter Levine on trauma through a child's eyes, which is a pretty big volume. And then there's a smaller volume, kind of more of a quicker summation. And there's lots and lots of SE skills for parents, teachers, and schools of working with trauma with children in those particular fields. So Maggie Klein has done a lot of work with kids. She was my beginning and intermediate teacher way back in the early noughts. And she is fabulous in that domain for children. So that would be a great resource. And I don't know if Abby, if you want to put in the link to Maggie's book, I think that could be helpful. So there's a lot I think you can do as a teacher, self-regulation skills, just even a breathing, inhaling when you're tracing the finger up, exhaling when you're going down, inhaling up, those kinds of tactile, somatic things are really, really handy. And I know that there are, some schools, and maybe not the public schools as much, are having a resource room that students that are really dysregulated can go to, that have squeezy balls and headphones and music and mats and fidget toys and things like that, that kids can address to help themselves downregulate. And there's our teachers that are staffed in that room to help children come back into a space where they can learn more. So yeah, let's see here. I think, yeah, coaching, it's a big field with many, many, many practitioners now, and it can be really lonely. And, I think for all of us, especially those of us that do one-on-one work, it can be lonely. And oftentimes there's still very few somatic therapists. I know in Albuquerque even, it's hard to know when to refer people out to. And so that is a big piece of scope of practice. And we'll talk more later about getting a really strong referral list. Okay, any last questions here before we jump further along? Oh, okay, let me go back to my screen here. All right, so these are some of the questions that are really important for you to ask yourselves to be able to know, what is my scope? How does SE fit into it? So first of all, if you're licensed in a profession, no matter how many, go back to your board of regulation and read, what is my scope, right? How do they define it? Then I would also highly recommend that you go to your professional organization. So for example, when I was a massage therapist, the American Massage Therapy Association was my professional organization. My social work one is a National Association of Social Workers. There's a teacher profession, there's the coaching alliances, there's yoga alliances, there's Rolfing professional organizations. They usually will address questions on ethics and scope within the context of the professional organization. Then ask yourself, is touch allowed by your license or your professional organization? So in the advanced year of the SE training, there are some touch tools and skills that you will be given because trauma happens in our bodies. It can be very helpful to have some supportive touch. And so does your license preclude you from that? Does your professional organization preclude you from that? What would be a trauma-informed response to touch in your particular field? So for example, in social work, handshakes, sometimes a hug if both parties agree to it at the end of a session, but there's typically not hands-on body work, right? There's no unwinding or necessarily touch, although I have done it on occasion. If you have malpractice insurance, find out what their allowances are about touch, right? And I have my own personal story to say that. And then a bigger question is, within your particular profession, where is this line between, where does the body end? Where does the mind begin and end? Where do the emotions begin and end? And how does the nervous system connect all of this, right? We're not defined like that. And that this is the ultimate challenge, right? Licensing boards and scope of practice is very delineated. And as a human being, we don't have those markers in our body, mind, hearts, and nervous system. And so teasing that out is very challenging. And then another challenge is complications if you hold 2 or more licenses. right? And I have a story on that. And what if you're not licensed at all, right? What is your scope? And again, your professional organization would be the go-to, I think, for that. And yeah, so I'm going to stop the share here and we're going to chew on some of these issues. Yes, so Mark has a comment, the clash between legalistic thinking and reality, right? I mean, in malpractice, in the world of risk management and malpractice, it's all about touch is the slippery slope leading to sex. And sex is by far the worst aggression and all of this. And so we have to do anything possible to minimize that. And so Jessica is sharing, my massage association doesn't recognize somatic experiencing as it's psychological in nature, and therefore I'm not insured for it through her malpractice. So that is really interesting. I'm curious, what massage association is that? The ABMP or the AMTA? Okay, and there's a link in there from Maggie, Trauma Proofing Your Kids. Yeah, that's the shorter book by Maggie Klein. Okay, so Jessica's in Canada, so it's the National Holistic Practitioners, I think is what that is, in Canada. So yeah, so read this, read about your professional organizations, this is the challenge, right? So you're not covered with malpractice insurance. So if you're doing massage therapy and working with a pain from a trauma car accident, there's some ways we can take this back. So I have a whole slide on body workers, so I'll get to that. I wanted just to share a little bit of my experience with holding dual licensure, because I held my massage license for a long time, even though I wasn't practicing, but I needed it in order to teach. I taught at a massage school for 34 years. And so I had to hold a current license in massage to teach at a massage school. And I was practicing somatic social work and trauma work. So I ran into a problem when a massage student made a complaint about me to my massage board. He was an aggrieved student that made a complaint to every single teacher in our school to the massage board, saying that I didn't hold a current license and that, it was really nonsensical types of complaints. So when I renewed my social work malpractice, one of the questions on there is, do you have a current open complaint with any board in any state? And I had to say yes, right? I mean, I had to be truthful. And so I had to describe it, and then they put a rider on my social work malpractice saying they would not cover any touch. So this is the conundrum, right? I was a practicing massage therapist for 11 years. I was teaching ethics at a school, and they said, we will not cover any touch work because you are licensed as a massage therapist. You would think that they would say, well, because you're licensed, you obviously know the rights and wrongs, but it's because you know. So if I had not had that license and I had gone through my SE training and in the advance getting the touch skills, I could touch all I want to, and there would not be a rider placed on my policy until there was a complaint, right? It's usually complaints that drive, these things into the light of day. So I did some consultation with Dr. Ofer Zur, who, and with Kathy Kane, and trying to figure out, like, how can I do my SE work in the context of social work, but I can't touch now. And, I just sort of ended up sort of not doing the touch stuff. It was just too challenging because I scoured my social work organization about touch, and they would say, depending on cultural context, a hug is important with some clients and not with others, and you have to use your clinical judgment. And touch wasn't outlawed by social work, but it needed to be applied therapeutically. But my malpractice said they wouldn't cover me. Eventually, I just switched malpractice companies, right? So that was my challenge with the dual licensure. And I wasn't using touch a lot. I had stopped giving body work sessions to people. But I had my table in my social work office in case I needed to do some touch work with my trauma clients. And it just got too much for me to kind of try to hold all those pieces. And so I took my massage table home. Now I have done some SE supportive touch, and I do a lot of, like hands-on, like working with anger. I use a big exercise ball and have clients push into that instead of into me. So I do use somatic body things. I have a lot of props, but I don't do a lot of touch work anymore. So Michaela has a question. How much can I recommend different SE exercises to professions that would benefit? I have a friend who is a forest school teacher, and I love the hand exercise you mentioned and don't see much harm in telling her about it. So, I think the challenge with a tiny bit of exercises for regulation without the person knowing about what is self-regulation, how could you tell if your exercise was promoting more regulation or promoting in person getting in trouble with, getting less regulated? That's, how knowledgeable is your friend about the nervous system? I think understanding polyvagal, understanding our survival responses I used to teach it to massage therapists, right? How to understand when your client may be going into a freeze response on your massage table. That's some really important information to know, right? And so I don't think that nervous system psychoeducation is part of many professions. And I think it's very, very important, because when you apply an SE exercise, how you apply it, what the context is that you apply it, the audience that you're giving it to, and the knowledge of the teacher are all factors that are really important. Like this breathing exercise, was actually a mindfulness tool that I used for kids, right? And it's a wonderful one. It can help people shift from a more freeze state by noticing breath, right? And feeling the tactile sensation on their hands. It can be great for kids to help focus their attention. And doing focused attention on your breath for some people can be very triggering. If they have breathing challenges from COVID, from asthma, from other traumatic experiences, focusing sometimes anywhere internally in their body can be really difficult, right? So, okay, you're in a forest school, you have a bunch of kids, maybe some kids have asthma, maybe we don't know if that would trigger an asthma event. So the question then becomes, how well does your friend in a different profession really understand this concept of nervous system regulation? And will they be able to, do they know signs of fight, flight, freeze, and fawn in their students or clients? And are they able to back out of an exercise without causing harm, or to know when to apply an exercise and when not? And this, I think, is the overarching question. do I have enough knowledge to apply this skill or exercise with my particular patient, client, student in this environment, and have this be promoting greater health and regulation? And do I possess the skills to know what to do if things go downhill, and how to have an exit plan, essentially, so that the client doesn't get re-traumatized or overwhelmed or more dysregulated? Right? That is the essential discernment question in the moment. How regulated is this client? How many resources do they have? So I always err on the side of doing less rather than more, and establishing some really solid skills of orienting, tracking sensations, resourcing, embodying resources. Can a person know when a resource is good? What happens in their body when they use a resource? How do they know it helps them? I think those are all some basic foundational SE skills that can move our clients forward in their lives. So that would be applicable to coaching, it would be applicable to body work, it'd be applicable to movement, without diving into the past and getting the storyline of the traumatic event, which for many professions, other than pretty much all except for mental health, you don't want to go digging around in the past, right? The beauty that I have found with SE is that the body will always show you what's happening in present time, right? So that you don't have to root around into past historical stories. Does that make sense? Right? If a person comes in saying, oh my God, it's a horrible week, I was just, so off my game. Well, what were you noticing? Or is that happening to you right now? And what is happening in this moment in your body? How do you know you're off your game? What are the signs and symptoms of that? Right. So, any questions before we move along? These are brilliant questions. Right? I mean, this is, for me, it's this, I want to make SE principles so available to everyone, right? Like, I would like the preschool teachers to know about SE principles and how to apply that. I would like to know, my mom is 100 and she's in assisted living, and I would love for their staff to know when someone is in a fight mode, a freeze mode, or a flight mode, right? When you're working with elders, and many of them with dementia, right? And how to do some resourcing, calming things. That would be great for assisted living facilities, right? But so there's this, I'd love for this information to get out there. And what is the scope of practice of people really working in depth with someone with their nervous system and their responses? So I think for the most part, skills like orienting, resourcing, and sometimes tracking sensations are pretty basic and pretty applicable for a broad range, and that you're not going out of scope for most of you with that. But really doing some focused attention on what's happening with a particular incident may not be in your scope. Okay. So, any other questions before we move along? Okay, let me jump back on my screen. So, educating yourself about your profession, your association guidelines, your licensure regulations is all kind of the starting point of your scope of practice journey. Okay. So, body workers using somatic experiencing. I feel like this is such a natural fit. I felt like I came home when I discovered somatic experiencing. I was just in the transition from body work into more social work practice. And it's like, yes, this is my language. This is so wonderful. So I think your best ticket with body work and somatic experiencing is you will stay in scope of practice if you always bring things back to the body. So, for example, let's say your client comes in and maybe they lost a parent recently, and they're saying, I'm grieving, but I'm also angry about stuff. Like it's never going to get resolved now. They're dead, and I miss them, but I'm also angry at them. And I haven't been sleeping well, right? That may be something that your bodywork client comes in to tell you. So as a body worker, you don't go into the storyline, right? You don't go, oh, when did your parent die and what did they die of and why are you angry? That is not in scope of practice, right? Because body workers, movement people, you can't go into past history. You can't deepen emotion, expand emotion, or advise them about what to do, or counsel them about what to do. Can't give advice for those things. But what you can say is, okay, are you noticing some of that kind of confusion between grief and anger? Like where do you feel that in your body? What is that sensation in your body? Do you feel it right now? And where in your body are you feeling this? So they might say, right now the anger is strongest, and boy, is my jaw tight. Like there's a part of me that wants to scream at them. And then as a body worker, you might say, okay, so are you okay if I work on your jaw? Right? That would be using, and you might work on the jaw, do a little massage, and maybe ask them to open and close. Maybe the client has some release of emotion, some tearfulness, or maybe just a deep sigh that maybe has some sound to it. And what are you noticing now in your body, right? Always returning, don't asking, oh, has the anger decreased? That is not a question for a body movement yoga person, right? It's like, what are you noticing in your body now? Is the anger, do you feel your jaw is tense, right? And maybe there's more tears, and it's like, well, now that my jaw is loosened, there's more grief coming up. Oh, where are you? What is the sensation of that in your body, and what part of your body are you feeling this in? Are you okay if I put my hand, if it's in the chest, let me put my hand under your scapula and on your chest, and let's notice what happens in your body. Okay, so you don't want to deepen emotion, further emotion. You want to your scope is within the body, so you can go into the body and still work with emotion, right? But not advise or counsel or etc. Certainly you want to practice the skills of titration and not have cathartic emotional releases on your bodywork table. As you've learned from SE, cathartic emotional releases are not that beneficial to the nervous system. It's way too much expansion, which then leads to sometimes even further contraction as the nervous system rebounds after the session. For body workers, understanding transference and countertransference is really profound because touch puts you directly into the nervous system. And many clients have a lot of trauma around touch from their caregivers, from their childhood, from medical procedures, etc. So there can be a lot of transference, countertransference issues, which sometimes are not really addressed in massage school, but it's a very important piece. I also wanted to highlight to you kind of a disturbing trend that I was just advised about last spring, and it's something called sexological body work. And it's not allowed, technically not allowed anywhere except in California. And it's its own certification program. And it's all about enhancing your sexual experience in life, which is a natural and normal part of being human. And people don't need to be body workers to get into this program. They don't need to have any kind of psychological license. This is an unlicensed certification program where there's a lot of touch, and a lot of touch in the genitals and in groups and with partners, and it's asking about boundaries and needs, and it's completely unregulated. And I went on the sexological bodywork website and I looked at they say, oh, we teach about trauma and, et cetera. And consent is always important. And there's so much trauma around our bodies and sexuality that I think it's a huge thing that may be really challenging and cause a lot of re-traumatization. And so just be on, I looked on their list of practitioners and they're all over the country, even though technically it's only allowed in California. So anyway, this is some of the ethical challenges because, as body workers, with any of your clients, sexual trauma may arise. There's power dynamic issues with it. There's body issues with it. And some people may say, hey, I saw this thing on the website and maybe I should do this. And it's a pretty unregulated certification field at this point in time. I'm sure many people have benefited, and I think there's a huge potential area for re-traumatization and traumatization in that particular modality. Okay, let me just jump off of this and see if there's any questions around the hands-on professionals, the PTs, the massage therapists, the yoga teachers, movement therapists. So maybe nothing. I hope for Jessica that that you have questions about the massage. I've had profound releases from my car accident with SE body work. It is incredibly healing. Yes, that's a great question. So Barbara has a question, which I'll address later, on specific advice or perspective about SE mental health treatment in the virtual setting. So yeah, it's a little bit more challenging for sure. I do think that SE and body work is profound. And Jessica, I don't know, are you finished with your SE training? I don't think she's on screen right now. I do think you can bring it into your massage practice in a way that you're, not going to be rooting around in historic, other than through the body, right? It's through the body that you have to do your work. Does that make sense? Yeah. Okay, here. Intermediate level. Yeah, so you'll get, in advance, you get a whole lot more touch skills that I think will make you have a sigh of relief for that. So I think it can be profound in body work. I had so much release of my whiplash from that. So okay, so there's a question about coaching. I have a question about coaches not being able to address anything that happened in the past. The coaching modality I'm trained in is rooted in neuro-linguistic programming, which does incorporate timeline work and re-imprinting outdated belief patterns. I'm curious how to go forward. So, I am not a coach. I have not been through coaching school. I did just teach a navigating trauma course for a coaching school. And I'm not doing it anymore because I'm not a coach, so I'm not allowed to teach. They had to have one of their staff teach with me to make it a course that would count for credit, and they don't have the bandwidth for that. But I was told on there that as a coach, you can't go back into the story. So I'm not sure. So I would defer to you, Rochelle, on that. If you were trained in a legitimate coaching school and you were like an accredited coach and that was NLP, just go with that. Where's the fine line between outdated belief patterns that manifest in the body that have trauma as a background, that then what is the difference between that and mental health counseling, right? To work with cognitive strategies to update outdated belief patterns, right? There's sort of this crossover, right? Okay, interesting. So Mark has a comment. There's a huge variation in coaching, and it's really not well regulated because the International Coaching Federation is behind the times. Okay, so yeah, so I think there is in the coaching school that I did 2 classes with, they do some EMDR work, which EMDR is really only open to registered mental health professionals. So I am confused about that with coaches as well. And I know that many coaching schools, or at least the one that I kind of got to know a little bit, use nonviolent communication strategies and skills, which is not a mental health intervention. I mean, it can be a mental health intervention, but it's also for groups and communities to do nonviolent communication. And I have an update here from Joe on the sexological body work. Thank you. This is so helpful. She's saying it is not allowed in California. It violates the prostitution statutes. And sexological body work was approved as a post-secondary education program in California, but is no longer approved as such. It was never allowed as a profession legally where one gets paid for sexual acts. So, okay, I'm really happy to hear that. That gives me some relief. So, is this everything you didn't want to know about scope of practice in this webinar, right? It's kind of complicated, right? And there's so many different threads and so many different training programs. And, again, the SEI Code of Ethics just says, do what you're trained in the context of trainings, in SE trainings, right? But this is such a profound question for us as SE practitioners that, the organization wanted to bring this specifically into an ethics webinar. Okay, I'm going to jump back on my, I've got a few more slides left. So that was the body work piece. So some best practices here. It's really important to educate and inform your clients about your scope of practice up front, to see if you're the appropriate practitioner or coach or therapist or whatever for their particular issues. You also need to look at how you're promoting yourself with, if you're a body worker saying, I work with trauma, or I work with PTSD. If you wrote PTSD specifically, that would be kind of a violation of scope, because PTSD is a mental health diagnosis, and that is not a diagnosis that is worked with in massage therapy. So really look with a very discerning eye about how do you promote yourself in online brochures, with other professionals. What does your malpractice insurance have? I know for some of you allied health people, that malpractice insurance is not so easily available, like for a mindfulness teacher. not always easy to get malpractice for one of these not so common professions. What is your protocol if your client gets overwhelmed or starts decompensating? Like, do you have strategies that you can employ in your particular professional field that can back you out? So, we talked earlier about the nervous system feels safer when there's context, choice, and connection. So if you are, let's say, a coach and you want to do a somatic practice of learning to track sensations, if the client gets in trouble, if they get overwhelmed and flooded by too much sensation and too much trauma sensation, which can also happen in body work, how do you step back from that, right? Do you have skills that says, okay, you're noticing you're overwhelmed, like, let's come back to orienting. I want you to open your eyes. We're going to stop this practice, look around, orient, what happened there, right? And begin to just kind of check in with your client, patient, person to see what happened that triggered them, that got them overwhelmed. We live in a Western, especially in the Western culture here, we live in a society that is very disembodied, and often beginning to turn your attention on internal experience and sensation can be really overwhelming. And the body, in all of its wisdom, says, oh my God, you're finally paying attention to me. Please, let me tell you a lot right now, right? And the client can get overwhelmed. Another thing that I have seen more and more, I don't get on Facebook very much, but I am part of the SE practitioners, the SE International Facebook page, that there's a SE practitioner worldwide page. There's a personal group for personal experiences with SE. And those are, certainly they have an administrator, but what I'm always so surprised at is a client will jump on the personal practice page, which is open to anyone, I think, that is in doing somatic experiencing work. And they'll all of a sudden divulge this is my experience with my SE therapist, and I'm so overwhelmed now that I can't work and I don't know what to do, and they didn't tell me anything. And I'm going, uh-oh. And then they're getting advice from somebody, bunch of people, that some of them may be SE practitioners, others may not be. And, it's like, did this client tell their SE practitioner what was going on? Or are they just trying to get advice online? And if you're a person that is on these sites, do you give advice on Facebook about nervous system regulation and working with trauma and preventing overwhelm? And, because that goes out there with your name, and what is the liability? Because not everyone responds in the same way. And you might suggest, do this, and it may backfire. And it's just sort of a little bit of a minefield about giving advice online, especially when you have a client that has a trauma history. So again, discernment, being aware, and ethics in our work, especially if you're doing one-on-one work, ethics has to happen within us. We have to have part of us that is paying attention to what we are doing in session, so that we can discern if we are in line, if we're doing things out of integrity, if we're staying in our scope. Like, we have to have this dual awareness that my ethical professional self is watching me do my work, and am I staying in my scope? Am I being ethical? Is this a multiple relationship? What's my confidentiality line? What's my boundary here? We always have to have that part of us that's paying attention to what we're doing because there's no cameras, no one's watching us, right? And so we have to hold that level and standard of ethics in a very profound, mindful way. Okay, here, let me, I wanted to address, I'm going to stop the share here for a minute. I wanted to address, there was a question about using SE in the virtual setting. So obviously it's hard to do props, although sometimes I will ask a client to get something they can squeeze, right? And again, online, you're typically only seeing from the waist up, so you have no idea what's happening below the waist in terms of, are their feet moving? What's going on? What are they experiencing there? So you may have to ask a client more directly. I'm curious what's happening in your lower body right now. Can you give me a sense of what you're aware of? So that can be challenging. You can certainly track sensations, you can orient, you can resource very adequately. In terms, if you have a brand new client and you've never met them in person, it can maybe take a little bit longer to establish some trust and connection so that you can, go a little deeper with what's happening in your body, and why don't you take a breath now, and let's let your nervous, or you're having a little bit of a wave here, a pendulation into some activation, and then, coming out of it. Education is really important to do, I think, before you dive into some very profound, deep trauma work online. And you would want your paperwork to have emergency contacts, right? You would also want an agreement that the person won't just drop off the call and end the session without telling you ahead of time, right? So you want to have some boundaries and some safety protocol established in the first session that, as we do this work together, if you need a break, please tell me. We have to figure out our pacing and what's too much and what's the right amount. And please don't just drop off the call without telling me. I've had this experience in some of my mindfulness workshops that I've done where the person just leaves the class and it's like, uh-oh. Sometimes it's right in the middle of a meditation practice. Because I do some classes on chronic pain and on mindfulness meets trauma, and it's like, uh-oh, what happened to them? I'm going to have to call them. And it makes me worry as a practitioner, like, you're gone, like, uh-oh. So you would want some agreements, some safety agreements that they have choice in the process with the intervention, that they have, if they feel like they need to leave, to talk about that, to not just drop off the call. So I think those kind of, you would want to have a phone number of a current contact, emergency contact, that you could call if they dropped off the call saying, hey, I was just doing a session, this person left. They're not answering my texts or my phone calls. Can you also be aware and check on them? Okay, so those would be some of the things that I would do. Yeah, so the Barbara who asked this question said I had to call the ER emergency contract during a session one time when a client became unusually drowsy. Said it was a medication side effect, but when they really disconnected from engaging with me, I had to call out. All was fine. The emergency contact was also in the home. So that was lucky, right? So that's good. So that's that question. Another question from Karen. It's been difficult to get insurance for being an animal doula doing SE grief work with horses and their owners. Brokers couldn't find anything, but they all wanted to tell their own animal loss stories and the need for doulas. So the insurance brokers were, wow. Yes. This is a challenge, right? With some of these newer allied health fields that come in, this is a huge and an incredibly important process. To be birth doulas, death doulas for animals, humans, all of that. Interesting. I would keep looking, Karen, for something that, yeah, interesting, fascinating. I'm hoping that as these modalities come forth more, that there will be more options for allied organizations to. I know that the American, body, what is it? The body psycho, no. Oh, shoot. It'll come to me. Not the ABMP. And it's a kind of a hands-on body psychotherapy organization. I don't know if any of you know it. Okay, so Jenica says the Energy Medicine Professional Association covers SE, EMPA, great resource, Energy Medicine Professional Association, USABP, that's it. Thank you, Joe. United States Association of Body Psychotherapy is sort of a body work psychotherapy field. And I don't know, they were thinking at one point of trying to get malpractice insurance for their member organization, their members. I don't know if the USABP has gotten that. So Michaela has a question. As I work with people with serious mental illnesses, including psychosis, when insight and judgment is often impaired, but often involves a significant trauma history, do you have any advice as how I can incorporate SE practices within my practice as a mental health nurse, considering their likely impaired insight judgment? I can inform them about SE, but they may not have the capacity to consent. So, great question. My first sort of just intuitive hit on that would be when someone is having, if they're in a psychotic episode, they won't be able to consent. Grounding, orienting will be the most important thing, right? To get them back in reality, however they can. And that may be all you can do is the challenge with working with the body when someone has psychosis is that can spin out. So just even a statement like, can you feel your feet against the floor? They may say, no, there's no floor underneath me. So that is really, really challenging. So the typical ways that we help someone orient can sometimes deepen their disconnection and their psychosis. Yeah, I think stabilization at that point, when they are not currently in a psychotic episode, you might be able to help them, with some basic resourcing skills, grounding, having eye contact, kind of things that could be helpful to help them kind of reorient to the present moment. So, boy, I sure wish that you guys could see all these messages. So Joe is letting me know that if you read the fine print of most energy medicine insurances that cover somatic experiencing, they exclude coverage for psychotherapy and counseling. So you are not covered for SE as you were taught it if you are treating someone's PTSD, depression, or panic. This is where, we are we are way outdated with our healthcare system and our malpractice stuff. I mean, we know that you can't separate and tease out PTSD and energy, working with the body in terms of PTSD is incredibly important, and energy medicine can be profound. And it's not necessarily psychotherapy, but yeah. So Joe, what you're highlighting here is read your policies, read your scope of practice, read exactly what is included, excluded, is touch included, excluded, they may cover SEE, but can you say, so this then starts to fold into how you do your record keeping, right? What do you say? How do you language your notes? I might just say, did some grounding practices for your person. You may not want to include their psychiatric diagnosis in your documentation for your energy work, right? I never put SE. I'll do trauma therapy, but I don't usually put somatic experiencing, because if my records were audited, they say, we don't know what that is, as the insurance company for payment, right? Although I'm a social worker, so trauma therapy would be included in my scope of practice. But read, be really, go through things with a fine-tooth comb when you are in a logical, calm state, right? Before you pay for any malpractice, make sure that you are covered with things. So let me go through my last few slides here. Make sure that this time goes by so quickly. When to refer. So, hopefully you have gotten this in your certification programs. This is mostly if you're not a licensed mental health practitioner, but what would be some of the signs that you might need to notice if a client were decompensating, so to speak, and needed to be referred out? So whether it was a yoga student or a coaching client. So you would want to know, if you're hearing that their moods are changing and getting more extreme, so increase in anger, anxiety, or sadness, if their day-to-day performance is decreasing, right? So if they're not getting things done at work, if they're not keeping up at home, if they're kind of checking out, if they're withdrawing or having changes in social connection or activities, sleeping and eating disturbances, being excessively tired, changes in weight, appearance, or hygiene. Typically, one of the marks of depression is less personal hygiene, right? And so are you noticing that, or not dressing the way they used to, expressing hopelessness or suicidal thoughts, right? So these would be the signs that they need mental health, professional mental health work, right? So if you're in an adjunct field, make sure that you create a really good referral list ahead of time, right? So that you can give them at least 2 to 3 practitioners' names, right? You don't want to give just one, because if it doesn't work out, they can come back on you, and you don't want to get kickbacks for referring to a certain one. And you want to include some crisis numbers. So there's a new kind of mental health 911 number. It's 988, that has been launched nationwide in the US, 988. You want to have local crisis numbers, like rape crisis or suicide hotline, 988 will suffice for that. You want to have emergency contacts in your paperwork. You want to know where the nearest mental health facility is. So in case you need to help someone get to a mental health emergency center. Typically you can go to a hospital, but some cities, like in Albuquerque, we have a mental health facility that's associated with our university hospital, and there's a separate, you don't go to the regular emergency room for that. You go to the mental health emergency room. So you want to have all of these things in place first before you have to come up with it on the fly. That way you're prepared, and you have counselors and psychotherapists and psychiatrists and maybe medical doctors that are trauma informed. That kind of thing is really important, and sort of track what's happening with your client so that you can see, because if they're getting too overwhelmed with what you're doing, there usually is some kind of decompensation, there's some kind of loss of functioning with the overwhelm, or there's more survival states arising of fight, flight, freeze, and fawn, and more disengagement. Okay, so read the fine print, and then understanding the harms that can happen when you practice out of scope of practice. So for example, if I were to do family therapy, I could cause harm, right? Because I've never been trained in family therapy. I don't work with parents and children all in one room together. I don't do marital counseling. I could give advice that would be counterproductive and harmful for that particular group of clients. So if you are doing trauma work with someone and they go too deep where you don't know how to help them regulate again, we all know that the trauma vortex can pop open, right? And this can happen in body work, this can happen in yoga work, and that's a thing, so what skills, what kind of like trauma first aid skills do you have that can bring the client back to the present moment and help them understand what just happened to them? Most people coming for a yoga session or a massage don't expect trauma material to arise. And so when you've settled them down and you've stopped the treatment and you've explained what's happened, that can help them integrate what happened. And then you can give some referrals and, hopefully, not do any body work or yoga in the immediate future and help them get some extra support. Err on the side of less is more, right? The homeopathic principle. Don't go too far, too fast, too deep with the trauma without having a rapport with your client in trust to be able to help them feel safe, right? Don't discuss medication changes unless you have the scope to do this. So I had an experience with a client that she was on antidepressants, and she went to her acupuncturist and said, I really don't like this medication. I've been on it for like 10 years. I really would like to get off. And he said, oh, you can get off. All you have to do is just stop the medication, and you'll go through a little acute crisis, and then you'll come out the other side. Well, it was not in his scope to tell her that she could get off her psychological medicine and just come through on the other side. She got really suicidal and was contemplating, she couldn't go to work, was contemplating killing herself. And that was really harmful advice that was completely out of the scope of practice of an acupuncturist. He was saying, yes, certain natural practitioners will say all allopathic medications are awful and terrible, and yes, let's get you off of this and come in for session maybe a little more frequently, but that can be literally life-threatening. So, have caution there. Also, be careful about recommending or advising or prescribing herbs or practices or stretches if you don't have the training and scope to do this. So For example, in New Mexico, we have to give nutritional advice, you're supposed to have a dietary license, like a licensed nutritionist, licensed dietitian license, right? But yet you can go into Whole Foods and say, gee, I have a lot of muscle pain. What would be good to take? Right? And these are just workers, right? That they're not body workers. I mean, they may be, but they will make a suggestion. They will not tell you to take a certain thing, but they will make a suggestion kind of along the languaging of, oh, many of our customers like this rub, this eucalyptus rub for this, or many of our customers like this homeopathic medication for this, and so making a suggestion is different than prescribing or advising. A tincture or whatever, like, oh, take valerian root, that'll help you sleep. You can't say that unless you have the scope to prescribe herbs. So if you are an acupuncturist or an herbalist or medical doctor or a prescribing psychologist, you can't make those take valerian to help you sleep, right? You don't, especially if you don't know what other medications they're on, that kind of thing. So know your own personal limits of what you can handle, the territory you want to go into with your professional field, and then also know your scope of practice limitations and things within your profession. So this is kind of a summary, err on the side of doing less rather than more. Yeah, so let's see here. Barb is saying SEI website uses the term supporting trauma resolution. Can we use that language if we are not mental health professionals? I don't know. I don't know. I would hate to give you that advice. Obviously, the training supports, the SEI website promotes the training that supports trauma resolution. You might say that you have skills that support trauma resolution. Yeah, again, you wouldn't want to say PTSD resolution, obviously, because PTSD is the diagnosis. Yeah, that is a really good question. That would be a great question for the legal department at SE. I will make a note of that and talk with the legal person at SEI, Kathy Halley, which I also have her email in here on the last slide. Great question, Barb. Angela has a question about referrals. If you have clients all over the country, how can we refer them to a local mental health provider? Oh, good question. Or is it sufficient to refer to a provider located anywhere, whether or not they are in the same state? No, because there's so many. The challenge of referring to a mental health person right now is most people are really full. There's so much need for mental health services that most people that I refer to do not have any openings. So there are some telehealth, BetterHealth or BetterHelp.com, I think I get solicitations all the time. Do you want to work in the telehealth field? Be a therapist for our site. So certainly 988 would be something that you could refer. That's the crisis line telephone number, kind of like the 911 emergency number for mental health. I would say if you take on a client that is in a particular city, you might want to just have a phone number for a local mental health hospital facility that you could just put in their chart. Certainly, you would want to definitely have at least one or two emergency contacts for people that you could say, hey, your friend, your spouse, your blah, 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 whoever needs further assistance. Can you support them in finding somebody local that they can see? Or can you take them to the behavioral health emergency room, etc.? Yes, the energy medicine, I don't have the website, but it's E as in Edward, M as in Mary, P as in professional, A as in association, EMPA, Energy Medicine Professional Association. So you could probably Google them. Whew. We have 9 minutes left. Any other questions? There's still 42 of you on here. That's great. So how does it work if working online with international clients reinsurance? I don't think there's any worldwide coverage. I can't imagine that there is. I know that I am credentialed in New Mexico for certain companies. And so insurance internationally, I don't have a clue about that. Even in other states, like I am not able to do, there's no reciprocity yet, or like I am only licensed for social work in the state of New Mexico. I cannot do telehealth out of state, right? Unless it's one of my current local clients that's traveling and maybe needs to see me. I think, yeah, so I don't think any insurance coverage internationally. I mean, it would be a great thing to do some research for, but yeah, I have no idea, because most countries other than America, it's national health insurance, right? They don't have individual policy plans like our system in America. So, whew, are you feeling saturated? Thank you, Karen, for staying online, and Susanna, and I think you're the only two faces that are moving. So thank you so much for keeping me ventrally connected. So, and Jessica's been on a lot, and Barbara. So, and Delilah, I think that's how you pronounce your name. Good to see you. I hope this has been helpful. So, you know, I don't have really specific questions, but my intention for this was to help you know what questions to ask and what kind of discernment and where you need to look to figure this scope of practice issue out for you. Oh, good. Incredibly helpful, Priscilla says. Wonderful. Wonderful. Yes. So, you can, if you want to reach out to me directly, you can go to my website. Let me type that in. Maybe Abby, you can type that in, because I can't get to everybody. My website is choosingmindfulness.net. choosingmindfulness.net. You can reach out to me if you have a further question. And again, I don't offer any legal advice, but I certainly know what questions to ask. Also, one thing that I've started doing that has been really helpful to my clients is I'm a meditation teacher on Insight Timer, and I have a lot of somatic experiencing basic skills as kind of practices on Insight Timer. And so, Abby, here's the link for that. It's insighttimer.com/choosing mindfulness. insighttimer.com/choosing mindfulness. If you want to give some practices to your clients, like tracking sensations or resourcing or orienting, I have recordings on Insight Timer that you can have your clients practice on a regular basis. Good. So Jessica, you've had lots of questions, super helpful. And yes, I used your session on pain on Insight Timer a lot. Thank you, Claire. Yeah, so I have like 20 different meditations. I have a growing your window of tolerance practice on there. So there's lots of skills that can support your clients through between sessions. I have one on pain and relaxing and working with anxiety and anger, all in a somatic trauma-informed way. So wonderful. Thank you all for your wonderful questions. And I'm getting some wonderful gratitude chats in here. So this has been great to do these. Thank you so much for your attention, for your time, and know that you can come back to this. This webinar will be posted in a few days on the SEI website ethics page, which you have to go into, put the /ethics to get to the ethics page. And these webinars will show up in time. So one more left, sometime I think in January, on creating an ethical practice. And we'll bring in things about paperwork and advertising and boundaries and all sorts of stuff that can be really helpful. So thank you, be well, thanks for your attendance, and take good care. Thank you so much for all the work that you do. It is so needed in our world today. So if you want to, you can come online and say goodbye to everybody as we sign off here, or just sign off. No, there are no CEs for this training, unfortunately. I do it locally in New Mexico for CEs, but not for this one. So take care, everyone. Be well. Stay regulated, especially in the next coming weeks.
Thank you.
All righty, take care.
Thank
Bye-bye.
you. Bye-bye.
Thank you. Thank you. Bye.